Hi everyone, this is Dr. Debes Chino. Today I would like to talk about proper and effective hand hygiene. This is a campaign beyond soap and water, and I'm hoping that by the end of this discussion, I would have given you accurate and comprehensive information that will help reduce the prevalence of infections related to poor hand hygiene. I'm going to show you the practical steps to take in order to properly wash our hands. I want you to follow me as I unfold all this for you. Globally, around 1.8 million people die annually as a result of diseases and infections related to poor hand hygiene. The UNICEF reported this in 2009, and ever since then the number hasn't reduced. It keeps on increasing. So this is of public health significance and has to be addressed. Because of the rising fatalities occurring every year, I established a research interest around this topic. I designed a health promotion campaign, but it was based in Awka, Anambra State, Nigeria, to teach about proper and effective hand hygiene techniques. This was also followed by a systematic review research that I did to find out the limitations of people towards cultivating proper hand hygiene. And I tell you, it was a huge success. Building upon that, I thought that when I bring this information to stakeholders and gatekeepers like you, what do I mean by that? The people that have the ability to make things happen. I know in your presence, we have people that are politically placed in high positions. We have a lot of people that have established businesses and are employing a lot of people in the community. So when I call you the gatekeepers or the stakeholders, I made no mistake. I thought when I bring this information to you, you are going to help me to disseminate this information by providing the necessary things that will help the people working under us, placed under our care, to be able to have access to materials that are going to promote hand hygiene in our different businesses, in our different education sector, in our different offices. Of course, there are a lot of diseases associated with poor hand hygiene. For example, influenza, common cold, chickenpox, meningitis, multi-resistant Staphylococcus aureus, E. coli, hepatitis A, gastrointestinal infections, and of recent, coronavirus, COVID-19. Hand hygiene is any action you take in order to wash your hands well. So when it is proper and at the same time effective, it simply means you've done it so well, and it will now help to reduce the spread of infections. Here are instances where you need to clean your hands. 1. When they are visibly dirty. 2. Before and after eating or handling food materials. 3. After using the restroom. You need to not be in a hurry. Stay back. Wash your hands. Dry your hands before coming out. Or at home, you have children. When you want to change their nappies, please wash your hands. And after changing their nappies, also wash your hands. Or you have an elderly one that has any kind of incontinence, before you change a diaper, please wash your hands. And when you're done with that and disposing the diaper safely, also wash your hands. After blowing your nose, that should be the 4th instance. After blowing your nose, please, it is advised to use paper towel so that you can blow your nose, fold it, and trash into the nearest bin. And when you want to sneeze, instead of sneezing into your palm, that touches a lot of things like your mobile phone, that you extend your hands to greet people. It is advised that you sneeze into your elbow. So this way rather than this way. That's the best way. And when you handle any dirty tissue, wash your hands or sanitize your hands. And the fifth instance for those in hospitality and care sector, before you visit a patient, before you enter into any ward, it is always a medical protocol that you clean your hands and wear your gloves. Attend to the patient, and when you are done, remove your gloves and clean your hands again before leaving the department. So these are the instances where you need to clean your hands. Here are the steps on how to properly wash your hands. First, find a tap and wet your hands. After that, you apply soap. This could be liquid soap or bar soap. Whichever one you have, you can use. When you're done, you rub your hands palm to palm. Palm to palm. And after you are done, you rub the back of each hand with your fingers interlaced. When this is done, you rub your palms together with fingers interlaced. The next step is to rub with back of fingers to the opposing palm. This is to help to clean out anything that is trapped under your fingernails. Then proceed to rub each thumb clasped in opposite hands to focus basically on your thumbs. When this is done, rub the tip of fingers. This will entirely wipe whatever is remaining under your fingernails. What comes after is to focus on the wrist. So many people do not know that the wrist is also part of the process. So 1 to 2 cm of your wrist, you rub each wrist with different hands to make sure that you wash off any sweat or dirt that is trapped there. And when you are done with this, you go ahead and rinse with water. Remember, the water is already running, you're not touching anything. You rinse with water, rinse thoroughly, and dry your hands when you are done. You can use paper towel. You can also use cotton towel. It depends on anyone that is available for you. Please, this is not the same thing as using bowl to wash your hands. It's a common practice that we used to do back in the days, and it's no longer advised today because so many people wash their hands into the same water and another person will use it to still wash their hands. It is not advised nowadays. So when you are done rinsing, you wipe with paper towel or cotton towel, whichever one you have. And what to do next? If you have hand sanitizer, this is when you can use it to sanitize your hand. Now you can see the difference between how you've always done it and how it's properly done. And to all stakeholders and gatekeepers like you and I out there, all I'm asking is that you adopt the good hand hygiene policy in your establishment, and also make provision for disinfection gel, hand towel, or pocket hand sanitizer, whether big or small, but to ensure that the alcohol level is above 70%. We make provision for all these things, including clean water supply and other sanitary facilities, making them also available to them and to the people working under us or people around us, and also to our loved ones. Then we can reduce the prevalence of these infections and diseases in our communities. Finally, and to recapitulate, we are at war with certain preventable diseases. When we maintain good hand hygiene, we are going to cut it down in the next 6 months to 1 year by 50 to 60%. If you cannot encourage, then help to provide. Remember the sequence of hand washing? Do not forget to include the wrist when doing so. Health is wealth. Thank you so much for watching, and until next time, be safe and love one another. Bye for now.